Can you tell us a bit about the University of Toronto Orthopedics program?
Yeah, so let me preface that by saying that I've had a chance to see a couple of different aspects of orthopedics. So my first job was actually in California. So I worked as a professor of orthopedic surgery at the University of California, San Francisco for 2.5 years. And I will tell you that I chose to come back to Toronto specifically because this was my dream job. Number one is we're the biggest program in North America. So for one university to have access to as many different teaching sites as we have, and 50 residents in any given cohort between PGY1s and PGY5s, plus hundreds of teaching fellows, we are the biggest program in North America. There's also a lot of history written in Toronto. So, the tau classification, the Schatzker type of fracture, all these things are people that still have an office right next door to mine. Actually, there's a plaque saying the Tile and Schatzker office right next to Sunnybrook. Same thing with like Salter Harris fractures at Sick Kids, right? So I think we're a program that's steeped in history, but most importantly, I came back because I've got really good colleagues, the people that I want to work with. They're people that I enjoy working with, and I really appreciate how smart they are and what they bring to the field, which makes it a really enjoyable place to work. So overall, I will tell you that there are no bad training programs in Canada. No matter where you go in Canada, you will be well trained. If you were to go to the US, I tell you there are really good programs, there's average programs, and there are poor training programs. So you have to be careful where you match if you go south of the border. But in Canada, we're small enough that we all know each other. Everybody's well trained. You all come out to be competent. But I think Toronto, to me, was specifically desirable because it just has recruited this rich history and these really good people. And you'll see everything by the time you come through here. There's not an aspect of the specialty you won't be exposed to. So you really get a chance to see everything and make up your mind where you want to go after having seen everything.
Great, thank you.